We've been in contact with somebody. Yeah. Be careful. Be so careful.
About time, boys. About time.
Thank you, though. All right.
Em, ready?
Telling him that. We'll spread that around.
Everyone come to order, please. If you have any electronic devices, please silence them at this time. It's a $5 fine for our coffee pot. Anyway, welcome everybody here to the March 10th board meeting here in beautiful town of Freeport. All right, I'm going to ask Pastor Sam Brown from Cross Point Church to come forward for the invocation, and then the pledge is right behind it. Please stand.
Would you join me as we pray? Father, we thank you for today. We thank you for this opportunity to gather. We want to pray, Lord, most of all for your wisdom and your guidance as we discuss these important details for today. We thank you, God, for all these leaders for taking the time to be here and to help us to push our community forward. We love you, Jesus, and pray this in your name. Amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Sam. We have, Tony, if I give you a few minutes to what you want to talk about.
Yes, we had one of Walden County's own, was honored by being inducted into the Florida Veterans Hall of Fame, Mr. Colonel Mike Flint. And a little bit about Mike. He was a pilot in the Air Force, served his country greatly and bravely, but he was even a better citizen of Walden County. He and his wife Charlotte, both very active, were both very active. Charlotte still is in the Republican Party. Charlotte's a state committee woman for our area. But Mike gave his time with no expectations. He was a perfect example of what a citizen should be. He served on the CBA, very active with Northwest Florida State College, South Walton Utilities, and many more things that Mike has done for his fellow citizens in Walden County. And I just want everybody to know what an honor it was for me to know this man, but more important, what a great citizen he was for Walden County. And I'm happy for Charlotte that Mike was honored with this, and I think as a county, we all need to be proud of what Mike did for our county. Thank you.
Thank you. Okay. Ms. Holly Holt, Department of Health. I think you got an update for us on the...
And I hope you all have a copy of the slides. They have changed since last week, but what we'll do, the presentation is actually in front of you. But as we move forward, a couple of the ones we'll go through, and I'll look at Lewis and he can kind of go through those, because last minute today, there was some new news. So I just wanted to make sure that you realize that what we gave you may be tweaked a little bit as we move forward. I also want to thank you for working very closely with us, with working closely with the Department of Health here in Walton County. We have open communication with you all, and I appreciate that so much. I know Dee Dee is our board liaison, and whenever I need anything, I go to her, and we're able to funnel things. But it's very nice to have a board like you all to work with so closely like we do, and we appreciate it from the Department of Health side of it. Okay, the presentation, we're going to go to the overview. We'll talk a little bit about COVID-19, the outbreak, our transmission and symptoms, treatment and testing, prevention, travel advisories, public health monitoring. And just like I said, this is fluid and it's flexible. What we talk about today can change tomorrow. Everything that we have comes down from the CDC to the Department of Health and then on down. So we'll go through this rather quickly. So at the very end, if you have any questions for me or anyone else has questions, I'll be glad to answer as best as I can. So on March the 1st, the Florida Department of Health reported Florida's first 2 cases of COVID-19 in Hillsborough and Manatee County residents. As a result, the governor issued Executive Order 20-51, directing a public health emergency and establishing Florida's response protocol for COVID-19. The state surgeon general issued a declaration of public health emergency for the state of Florida. So we'll talk just a little bit about the outbreak of the new coronavirus. And let me just mention to you, we've had coronavirus around. This is the new coronavirus. It's a novel coronavirus, and that's what makes it different, is because it is new. We're not sure a lot of things, so we're working very closely with CDC through the Department of Health about what we need to do to take precautions. So as you all probably know by now, it's a respiratory illness, and the outbreak first detected in Wuhan City, Hubei Province, China. The first case is linked to a seafood and live animal market. It's person-to-person spread, and it's spread to other countries, including the United States. And this is where I'm going to add a few things to this, Lewis. The widespread transmission and restrictions on entry to the U.S. is a level 3. So when we talk about level 3 and level 2, there's reasons for that. Level 3, there's 4 countries that are banned in moving back and forth to these countries. It's China, Iran, South Korea, and Italy. And then a level 2, when we talk about that, we're talking about the country of Japan right now. Countries with a level 3 CDC travel advisory, these are the countries that I just talked about, the 4. It's a mandatory 14-day self-isolation. Develop respiratory symptoms, contact healthcare provider or county health department. So that has changed recently too. So if these individuals have gone into these countries and they come back, we're basically, most of them we're notified by the CDC by travel and things like that. But if not, and they develop respiratory symptoms, they need to contact us or their local provider. And then we'll talk a little bit about testing later on. Countries with a level 2, and now they've included cruises to that. They're to monitor health and limit interactions with others for 14 days. So that some of the individuals are thinking about taking cruises for spring break. This is where you need to think about this, because if you leave the country and you come back, you've got to limit your interactions for 14 days. That definition is a little vague for most people, depending on what your job is. For me, that would be very hard for me to do, is limiting interactions unless I worked, through my house or whatever, telehealth or for that. But in those individuals that develop respiratory symptoms, immediately self-isolate, and they are to call us or their provider so we can do some testing. So that's been kind of the new news, is the cruises with level 2. And that all came back, or they came down to us through CDC, through Department of Health. Okay, I'm going to continue to talk a little bit. As of today, this changed this morning, there has been 647 cases in the United States. The CDC has actually been working on various numbers because we have actually introduced new testing sites. It has been just the county health departments through public health, and now they've opened up some more testing sites that's going to become available to our side of the country. And because of that, CDC is kind of not quite sure exactly what the numbers are today, but the approximated numbers are around 647 cases. We have had 19 cases in Florida. For Department of Health, our highest priority is to control the spread of COVID-19. As of today, protecting the most vulnerable individuals in our community is mainly very important to us. And of course, that's elderly and those that have comorbid conditions, diabetes, hypertension, things like that, that we all seem to get as we get older in life. So those are some of the things that we worry a little bit about. Today, I wanted to let you know we had a meeting over at the health department. Jeff Goldberg helped me with that through emergency management. He's going to speak a little bit at the very end of this and talk to us a little bit. But we met with healthcare partners, with schools, with law enforcement, fire rescue, and we are going to continue having monthly meetings, or we're also going to have some focus groups on what our next steps are going to be for our community. We did talk to those individuals about specifics, PPE, that's protective personal equipment, what they would be wearing if they come in contact, different things like that that we need to make sure that we're doing in our community to keep everybody safe and free from COVID-19. There are some Department of Health that's having some weekly calls for clinicians and healthcare providers. I think they are also adding educational institutions to those calls. So they are coming out. I don't have that list right now. That is something I'm trying to get my hands on. But if anybody's interested in that, they can reach out to us and we can get that information to you. So let's go to transmission and symptoms. This is real. Hopefully if you hadn't seen anything else on the news media, you've talked about how this is transmitted. We've talked about how this is transmitted. So for COVID-19, it's mostly often spread from person to person. Spread through respiratory droplets from an infected person who coughs or sneezes, spread among close contacts. So basically the 6 feet is what you need to be thinking about, and it's very hard for some of us to do that. I heard a couple of people in the audience talking about the elbow bumps, and basically they are correct. That is what we're supposed to do, but it is very hard for us to want to do that. Symptoms can appear 2 to 14 days after exposure. Fever, cough, difficulty breathing. Those are some of the things that individuals will experience. Okay, we'll move on to treatment and testing. The CDC recommends people who think they may have been exposed to COVID-19 should call their county health department, and let me add something that's changed, or their healthcare provider immediately and self-isolate. From that information that we receive, we have an algorithm that was changed this morning, on the individuals that we would need to test, and that's basically a swab test that we send up to our laboratories either in Tampa, Jacksonville, and Miami. I think our tests go to Tampa lab, so for us. But there are some tests that are coming out like through LabCorp, Quest, some of those things, the very near future if that didn't happen today as we speak. Testing is currently only available. Okay, and see, that was what we had up there, and that has changed from the other day. So the CDC developed a test for COVID-19, and a little bit about the testing is DOH, Bureau of Public Health Laboratories, are testing with CDC's test kits, and that's what I was talking about in the 3 labs across our state. The Food and Drug Administration, who approved the test, requires that presumptive positive results are sent to CDC for confirmation. So when you see something that someone has written, they said these are presumptive cases versus confirmed cases, these are the ones that look like they are confirmed through our labs, and then what's sent to the CDC, they're approved for confirmation. So that's the difference in when you see presumptive and confirmation. And then the next is not any longer. So we'll move on to the last bullet. For persons who meet CDC and DOH criteria for COVID-19 testing, your healthcare provider can work with your local health department to test you. We've been working very hard internally with our health department on trying to figure out the best way to keep the least exposure out to individuals as they come into the county health department. So we feel like we have worked out a pretty decent plan for that. Like I said, PPE is very important, and that we do the testing where it doesn't affect a lot of the individuals that are coming through our health department. So we're working very hard on that, and also with the other healthcare providers in the community. International travel or contact with a COVID-19 case may put you at risk. People who have traveled internationally, we talked a little bit about this earlier, but people who have traveled internationally in the last 19 days, especially to identified areas, there is a website for that on CDC that individuals can go to and look at that to get more definite information. They can always call us. People who have had close contact with someone known to have COVID-19, and this is what I was talking about. Risk may change over time. This is the fluid part of this. We don't know from one day to the next basically what we're dealing with. For more information, we have the CDC website that you can go to, and it's very easy to look at that. So talking about what do you do to kind of continue about, we haven't quite gotten to prevention yet, but for some treatment or prevention, if you think you're at risk and have symptoms of fever, cough, or difficulty breathing, take these steps. Call ahead to your healthcare provider. Tell them about your travel or exposure and your symptoms. You can only get COVID-19 from someone with the disease. Avoid contact with others. Do not travel while sick. Cover your mouth and nose when coughing or sneezing. Wash hands often with soap and water for at least 20 seconds, especially after coughing, sneezing, or blowing your nose. And this is very important. This is spread through respiratory droplets. So we need to make sure that we are doing this every day. Teach your children, teach yourself, teach others in the community with that message. The next part, talking about prevention, this just goes through the steps again. Wash your hands, use hand sanitizer with at least 60% alcohol, avoid touching eyes, nose, and mouth. I'm going to tell you that is one of the hardest things to do because I find myself wanting to reach up and touch something, my hair, something on my face. So those are some of the things we really need to think about. And what is important for me and most people, stay home when you're sick. I know that is one of those things. I talked with the school board the other night, and we talked about that, and I told them, I said, I know I'm going to get the X for that, but my mother was a teacher, and I told them at that point in time that, they want people to be in schools, but in this situation, we need to work very hard to know that people can stay at home when they're sick, and their bosses, their supervisors, their businesses understand that as we move forward. Okay, travel advisories. COVID-19 travel updates. It is prudent for travelers who are sick to delay or avoid travel to affected areas. General recommendations for personal hygiene, cough etiquette, keeping a distance at least the 6 feet, or some of the things, a hand. This just goes over some of the things we just talked about. And a medical mask is not required if exhibiting no symptoms. When you talk about PPE and some of the things that we have to do on the healthcare setting, there's certain things that we have to wear. One is an N95 mask. But for everybody else that comes in the door that thinks that they have COVID-19 or symptoms, they can wear a regular mask when they first come in, and then we start doing the testing. Okay, we'll move to the next one. And that one, let's move to the next one after that. This is just one of the signs that the CDC has put out for health alert for travelers. Okay, then we can move. Public health monitoring. DOH is monitoring those possibly exposed. Personnel at the agency's 67 county health departments and central office in Tallahassee work together to protect Floridians from emerging diseases. DOH receives information from CDC on U.S. citizens, residents, family returning from the impacted areas. We've actually gotten names. We've been monitoring people already in our county. We do not have any presumptive or confirmed cases in our county. In Walton County, there has been confirmed cases to our neighboring Okaloosa County and also Santa Rosa County, but we have yet to have any confirmed cases in Walton so far. CHDs work with travelers to restrict their movement, monitor for illness, isolate persons with symptoms, and ensure healthcare providers use proper infection control techniques. So some of the monitoring process, talk about for people who have been exposed but have no symptoms. We've already kind of talked about this. Monitor your symptoms for 14 days. Self-isolate yourself. Stay home as much as possible. Avoid travel on publicly used vehicles, gathering with groups of people, and going out in public. Excluded from work, school, and other public places. And follow provided education to prevent the spread of infection. Those with suspected or confirmed COVID-19 are asked to take these precautions, immediately isolate at home. We've talked about that. Do not participate in public activities. We've basically gone through all that. Only travel by ambulance or private car and avoid public transportation. Always wear a mask when around other people or pets at home. Always cover your coughs and sneezes. And that goes back to the CDC website with some of that information. Okay, immediate risk to Americans remains low. Most cases in the U.S. are likely to be identified in the coming days. There's currently limited person-to-person spread in the community, but this could change. Everyone can do their part to prevent the spread of COVID-19 and other respiratory viruses. I know we talked a little bit about, people have asked me questions about how it relates to the flu that we actually have going. You know, we have deaths that we have from the flu. We have deaths. But this is new, this frightens people a lot, but I want to assure you that going through some of the precautions that we have, just washing hands, just basic things, and then people letting us know if they've traveled and come in contact with somebody, call us, and we can walk them through the algorithms. So the rest of this basically talks about websites. I would suggest going to the CDC website. There's on the side of the CDC website, there actually has the different documents for schools, for businesses, and things like that. Okay, the last thing I want to say is there is a call center number, and it's actually located on our website, and it is 1-866-779-6121. It's the call center in Tallahassee that answers any questions concerning just basic COVID-19 questions. So I like to give that out just in case you have any questions. Feel free to call me if anything else comes up. And I'm going to turn it over to Jeff. He's going to talk a little bit about emergency management and what he's doing to help us in the community.
Mr. Chairman, if I may, while Ms. Holt was talking about websites, we will post all the pertinent information on the county website as well, and who to contact and where to contact. So if there's any confusion of where to go, they can certainly go to the county website and find it.
Yeah, currently, the very top of our homepage has the links directly to the CDC and to the Florida Departments of Health main COVID pages. We'll get on there, any additional information that we get, as well as that call number as soon as we can.
Hi, Jeff Goldberg for the record. Just to kind of talk about some of the things that we're working on with the health department. Walton County Health Department is the lead agency for any type of biological incident, this is what would be considered. We support them with planning, resource coordination, public messaging, some facilitation and coordination. Last night, the governor had issued a statewide declaration of emergency. Basically what that does is that frees up certain things regarding procurement. It names the state coordinating officer, which is the state level incident commander, which is the director of emergency management for the state, with the deputy state coordinating officer as the secretary of health. So we're actually been coordinating with state emergency management statewide. Actually, we've been doing statewide conference calls twice a week, as well as numerous other conference calls. A lot of what we're doing is we're echoing what the health department is putting out regarding public education, public information, working with HR to make sure that information gets out to the public, or excuse me, the employees, on how to protect themselves, signs and symptoms, things like that. We're looking at contingency plans if we do have some workforce impacts, and how we can continue our mission essential functions, providing services to the community. And then resource coordination, there's no supply chain issue. They're able to get supplies from point A to point B. The issue is the supplies. N95 masks, hand washing soaps, and things like that, they're in short supply. So we're working with the state, so if some of those issues come up and affect us here in Walton County, we can work with the state to make sure that that's alleviated for the first responders. And then again, like I said, we're participating on state and national calls, and basically whatever Holly and the health department need, we're standing ready to help assist them on it.
Thank you, Holly. Jeff, any questions from the board?
Holly, real quick, you hear everything on the news, and it's pretty much chaotic, panic, everything else. As I understand it, this is a problem for the more elderly people so 70s, middle age, right?
That's what they're saying, and I'm not saying anything specific to anyone.
But, I mean, they seem to think, I mean, nobody under 19 or something has gotten it?
Or is
So
it
far,
nine? I
yes.
read
Nine?
nine, I think.
Yeah, there's not been any small children.
Yeah.
And that is quite interesting because our flu season has been a little interesting with that because we've seen a lot more children this year, so, with positive
Right.
flu cases. So, yeah, this is totally, this is a different thing. We still need to look at it and not panic, and continue to work together, try to reduce the transmission, and people that are knowing that they've come in contact with something, that's our job to do contact investigation through the county. This thing could go really quickly, and then we would have to figure out how we would, how that would help impact our, our staffing resources and things like that. But that's why we're working with Jeff and some others, and we're always available to help other counties too across the state. We don't know if this thing will be regional. It looks like right now it's already moved into the Panhandle with a couple of cases. So, but we're just trying to decrease the transmission by getting the information out to everybody so it doesn't panic people. But we all think about if we're sick, we need to stay home and try to take care of ourselves.
If somebody called you in the morning and said, hey, I think I need to be tested, could they go to the health department and be tested?
We got a new algorithm today,
Mm-hmm.
and basically, if a person, if they call us, this is how we're handling it. They call the 892-8015, there I go with my hair, see, I have to be careful with that. 892-8015 number, then, and somebody calls and said, I'm worried about COVID-19, I think I might have it or possibly come in contact with it, then that's transferred to a couple of people, more than that. They're actually taking the calls, they go through the algorithm. If they've come in contact with somebody and because today, this was the new news for us, persons had close contact with a laboratory-confirmed COVID-19 case and fever or symptoms of lower respiratory illness, then they call us. That meets the criteria for us to do some testing. The next part of that is person who is part of a non-household outbreak of suspected COVID-19. They call us, we test them. The third, person hospitalized with unexplained respiratory illness or person who died for an unexplained respiratory illness, we will do the testing on that. What has changed today, because of these other tests that are coming out through LabCorp, Quest Lab, some of those other types of commercial laboratories, this is the new guidance for that. Persons traveled to or from an affected geographic area with widespread community transmission and has fever or symptoms of lower respiratory illness, and that's, shortness of breath when it gets down into the chest, then this patient does not meet the criteria for testing at the health department, but yet we can consider getting them a test through LabCorp Quest. The second part to that, person had community contact. They attended the same gathering with somebody that stayed in the same cruise ship, that kind of thing. With a laboratory-confirmed COVID-19 case and fever symptoms, then the same thing would go through the commercial laboratory. And then a person is aged greater than 65 years, has chronic medical conditions, or is in an immunocompromised state, and has fever or symptoms of lower respiratory illness, that can go through some commercial laboratory. So, but we have this guidance. As people call us, we help to work through that and tell the individual what needs to be done.
Thank you, ma'am. Appreciate it.
Thank you.
Call the meeting to order. Is there any additions or deletions?
I'm going to have one addition. I need to ask for an executive session. Just do that under my name if that's all right with you.
All right. You'll cover that when it comes up, okay. Is there any other additions or deletions? No. All right. Entertain a motion to approve the addendum with additions or deletions.
Motion to approve.
Second.
Motion and a second. All in favor, say aye.
Aye.
Opposed? Motion carries. This is time for public comment for any agenda item. So if you wish to talk about it now because you may have to leave or whatever, this would be the time to do it. If you come forward, identify yourself to the clerk. and then the item number that you want to discuss. Fred?
Fred Tricker, Tricker. This is not technically a agenda item, but it relates to the last presentation about the virus. Is it okay if I say something about that?
Well, that's normally
I
for the
understand.
end of the meeting. During that public, you can talk about anything. This here is about agenda
I
items.
got a real quick comment if you want to entertain it
I'll
right
take
now.
your quick comment.
My question is, that, if this gets a lot worse, like a lot of people think it may, we hope it doesn't, but it might. Is the county equipped to do video conferencing for meetings and workshops in lieu of getting people gathering in a big group like this to reduce risk? If you decided to do that, do you have the
Louis,
capability to do it?
I think we do because we live stream our meetings anyway.
Yeah, it'd be a little tougher to have the
Chairman,
public.
I explained to Mr. Tricker early on that, before the meeting, that we understood that concept. We would employ it if, A, it was legal, and B, it became necessary. So it'll certainly be the board's call, but we've had conversation with Holly regarding what changes the board may need to take in our everyday activities and in board meetings. So we did address that, Fred, and there's a legal component to it we'll have to address. There's a technical component to it, and we will work through all of that at the appropriate time if we get to that point.
Okay, thank you very much.
Thank you. All right, anyone else? Public comment, reference agenda items? Seeing none. Is there any items to be removed from the consent agenda for further discussion? Seeing none. Entertain a motion to approve the consent agenda.
So moved.
Approve. Second.
Got a motion and a second. All in favor, say aye.
Aye.
Opposed? Motion carries. Waste management is next. The EALs for waste management. I acknowledge my conflict of interest, will abstain from the vote, and have filed a proper form with the clerk.
Motion to approve.
Second.
Second. All in favor, say aye.
Aye.
Opposed? 4-0. Mr. Jones.
Thank you, Mr. Chairman. Our first agenda item is a thing of beauty with Ms. Teresa Bogart and some visitors that she brought with her. There. They're coming. I know they're gonna wanna do some pictures, so if y'all wanna come down
Start
front.
and or known down.
Hey. I'll just slide up in there behind them.
Y'all look mighty pretty.
Hold on, come back.
He said, what?
Here's the microphone. Whoever wants to talk into it.
We're both loud enough. So, hi, my name is Chris McClaney, and I'm Miss Apeniac Springs 2020. I'm a senior at Walton High School, and I'm active in cheerleading and many different community service organizations at Walton High School. I'm also a sophomore at Northwest Florida State College and plan to graduate with my AA this May, so that's very exciting. So now I want to introduce my sister queens. I have Teen Miss Defeniac Springs, which her name is Cameron Sunday. She's a 7th grader at Paxton High School, and her parents are Stan